I guess the first thing we did was in terms of preparedness and readiness. For some years now, indeed since SARS, we've been strategically working out how what we would do if this day happened. So there has been some infrastructure developed and legislation, things like this, all put in place for this time. From the moment we heard what was happening on December 31st, we were already activating. So all through January and February, we were getting everything in place, the different tiers of how we would implement as cases rose. So I think the readiness activities through January, February were very important. We had our tests ramped up before that we even had a first case on January 23rd. And we've been very focused on the virus. We work very hard to detect cases. We test them readily. They're all isolated in hospital, so that there's no risk of them being out in community spreading further. There's thorough contact tracing, which springs into action as soon as the case is identified, and any close contact is put in quarantine, home quarantine, and obviously that's very strictly monitored. So with this, we've been able to have a very flat curve. Indeed, most of our cases are imported.
Could the World Health Organization have done more to get other countries to take this more seriously?
I don't believe so. I think it was declared a fake on January the 30th. We went on the mission through February, and we made it very clear to the world that this virus can have devastating health, social, and economic impact. But we also said in that report that we doubted whether the world had the capacity or the mindset to deal with it. And sadly, that's true, except for a handful of Asian countries which did have that capacity and mindset to take aggressive actions fast.
Although, interestingly, you didn't close schools in Singapore, did you?
No. Children don't get severe disease by and large. There's no evidence that they amplify disease and spread it. In fact, in general, in China, we found that most children that were infected were actually innocent bystanders, if you like, in a family cluster. Many were asymptomatic even.
What are we doing wrong in the United Kingdom as far as home isolation is concerned?
I think it's a good question, because it is time to look forward. The current situation is what it is, and there's many cases, and I think it's really time to reboot the whole approach. It's easy to, well, I won't say it's easy, but it's what most countries are doing, which is just closing things and introducing sort of broad social restrictions on people. But I would really like to see more of a focus on the virus, on identification, on isolating of cases, of quarantining contacts, rather than quarantining the whole of society. Work on the people with the virus, or the people that might have the virus, and we keep them in hospital until their throat swab is negative before releasing them. And that's also done in Korea, China, Hong Kong, Taiwan, and Korea, of course, had a large outbreak and didn't have to have a lockdown. They just really concentrated on this isolation, detection, and quarantining of contacts.